Putting something unknown in front of us seems to unleash our minds, focuses our energy, elevates our game, and harnesses our collective will until it becomes a discovery.
If you think about discoveries in cancer, it's just not identifying one research or identifying one gene to make a difference. It's much more complex than that. You're dealing with a disease where every tumor may be different, the environment and how it interacts is different. We're here for one reason, that's to make differences in outcomes for patients.
Today, Moffitt is one of the fastest growing cancer centers in the country. Our purpose is clear: to end cancer.
I think the one thing to keep in mind is when a patient comes here, they come not just for expertise, but for new opportunities to have the best chance to beat cancer.
Your best chance of beating cancer is going to an NCI-designated center. And that's partly because of the research and the latest therapies and getting access to that, new technologies, but also the people who provide the care. If you have a difficult surgery or a rare cancer, you want somebody who does that day in and day out.
The results have been impressive. In our first 20 years of existence, Moffitt became one of the youngest institutions to receive the Comprehensive Cancer Center recognition by the National Cancer Institute, or NCI. Moffitt is the only NCI-designated comprehensive cancer center based in Florida.
We are preeminent in the country in terms of the research that we do. And one of the great things about Moffitt is the next generation of standard therapies are being developed here.
It's not just the research. I think a lot of this is having the right expertise, getting the right diagnosis from the beginning. But I do think rare cancer should come here. They're often misdiagnosed in the community, and people in the community don't have the expertise to manage really the rare cancers. More complex cases like stem cell transplants should be coming to centers that have large teams and large volumes of patients where you know you have the best outcomes.
Moffitt continues to develop uniquely effective treatments and techniques, aided by the large volume of clinical trials, research, and patients treated. Research counts because research cures.
Every minute of every day, somebody dies of cancer. What are we going to do about it? We need to do research. We need to invest. We need to figure out how to beat the disease.
We're trying to maintain our research at the highest level possible so we can have the best potential discoveries, which is going to translate into the best outcomes for patients. Moffitt's positioned better than any place in the Southeast to provide that hope and the potential for success for any patient dealing with cancer. You really have to have a different approach, and that's a team approach. We have some of the best people in the world here. We have oncology mathematicians that deal with modeling of how cancer can grow, so we can develop new strategies to intervene.
Who would have ever thought that mathematicians are going to be the solution to the cancer problem? These guys are brilliant. We've got at our fingertips the technology, the infrastructure, and at Moffitt, we have clinical outcomes and patients who are participating with us. And the success in bringing all of the different pieces of the cancer equation together is going to occur at a Moffitt Cancer Center first.
We are a major cancer hospital. We have not only outpatient activities and all disciplines of care, as well as the inpatients. We have surgeons, and they all specialize in different diseases. We have radiation oncologists. We have genetic counselors. We have the social workers. We have all aspects of care for the individual. Not only managing the patient, but also managing the family, what we call patient and family-centered care.
Quality of life for patients during and after treatment is an important result of our team approach. Shorter treatment times, reduced hospital stays, and most important, better outcomes.
The scientists from every discipline work together as a team to be able to elevate their science and their discoveries so we can actually accelerate what we can do for the patient. There's no doubt we have the best outcomes, but part of that is because of our multidisciplinary approach to how we manage patients.
There's not a single person in the organization who doesn't understand what our mission is: to beat cancer. That's why we're here.
The end of cancer begins at centers like this, the Moffitt Cancer Center.
I see it. I know it's going to happen.